Do you own a practice and you're feeling like you need to make some kind of significant change to your practice, but it feels daunting, maybe really daunting, and you feel kind of stuck? Well, I'd like you to take some inspiration from my guest today. My name is Carl White. I am principal at Mark Advisory Group, which is a healthcare marketing agency, and I'm also the host of Practice Care. And the mission for both is the same. It's to help private practice owners stay private. It's really what they want. And I personally believe that care is better when it's just you and your provider sitting at the table, figuring out what's best for you. And there's nobody else secretly whispering in the provider's ear about what their agenda is, whether it's a hospital or a health system or owners in faraway lands. It's just you and your practitioner sitting at the table. Not that that's any easier in this day and age, given how things are going and how they've been going. It's fighting the good fight. And any day that we can keep a private practice owner private is a good day for us. And today, my guest is Dr. Laxmi Naik. Dr. Naik is a board certified emergency medicine physician, and she's also certified by the Institute of Functional Medicine and the Board of Integrative and Holistic Medicine. After practicing acute care medicine at the busiest trauma centers in New York, she pursued holistic medicine for her own healing journey. She's practiced Isha yoga meditation for over a decade and has a deep understanding of Eastern healing traditions like Ayurveda and herbal medicine. Her practice, which is called Spectrum Integrative Health, focuses on blending ancient healing modalities with evidence-based Western medicine to help people heal with various conditions. And Dr. Naik, thank you for taking time out of your busy day to come on Practice Care.
Thanks, Carl. I appreciate you having me.
Absolutely. And it's really interesting. You are not the first guest that we've had, and it's not like Practice Care has thousands of episodes going for it, where the guests started down a path of tradition of Western medicine and lots of training, just like you, sometimes ER, sometimes whatever it was very extensive training. And then for different reasons, added in, holistic, alternative, integrative. For each of them, it was a different part that they added in into their practice, blending both, just like you. And so it's always very interesting. Whenever I hear any kind of career change, my ears perk up. You're an example of somebody who's, I don't know if it's a change, but it's a lot of training to go down the ER path, like a lot. You know better than I do. It's years. And then you look at this shortly thereafter and go, wait a second, I need to do more because that's not feeding the desire that I've got for the type of practice that I want. So I have to keep doing this and do more. So I'd love to hear, can you just fill in the gaps and just tell us that story about, you're going down the ER path, what that was like, then you add all this other stuff in, and now here you are running an integrative health practice. I think it's very interesting.
Yeah, I did emergency medicine residency in New York, and at some of the toughest places, with some of the toughest patient population. It was a lot of violent crime in some areas. There was a
Right.
lot of homelessness. There was a lot of drug addiction. There was pretty intense training, and and you know the intensity of the field and as it evolved, definitely had a toll on my body. And
Yeah.
I was I could feel my system sort of breaking down. I was getting insomnia, stress, not eating right, just getting unhealthy. And there was a point where I got diagnosed with an autoimmune illness,
Wow.
after years of working in the ER. And I went to my traditional physician and I said, hey, what do I do? And, obviously a gamut of tests were done and pills were suggested and medicines were suggested, to which at that point I said, well, I grew up in a South Asian family where, nutrition was key. My mom grew her own herbs. And I said, you know what, let's go back to the fundamentals. Let's start researching what's out there. And, from there, it sort of catapulted my interest into integrative medicine of saying, hey, how do I heal myself with food, with herbs, with the land, with what was given to us? And then the journey just sort of continued, and I wanted to know more and learn more, and, just healed myself out of the autoimmune illness. It's gone. And
It's gone.
it's gone. Yeah. I just took care of my titers and I just figured it out. And I'm not saying that's the story for everybody that
Sure.
you're doing this, but for me,
But it's hard to believe it's a story for just you alone either, right?
yeah. I mean, there are a lot of patients that we turn around for sure.
Yeah.
But it takes a lot of hard work, a lot of discipline and appointments with us. And it's not an easy road. And
Mm-hmm.
and so definitely got my health back. And then I said, you know what, I've got to share this because and then I couldn't go back and practice the way I was practicing. There is a profound place for acute care medicine in this country. I mean, we need it.
Mm-hmm.
And but the problem, the limitation with Western medicine is that it's a symptom-based approach, whereas integrative and functional medicine is a systems-based approach.
Mm-hmm.
You're not just treating, hey, I have a urinary tract infection, or I have a cough, cold, my pneumonia, can you give me some medicine? The symptom. With functional and integrative, you're like, well, why did I get the pneumonia in the first place? Why did I get this infection in the bladder in the first place? Let's look at it. What's going on? And so when you go to that fundamental level, you can change a lot of things.
Yeah.
You can address it so it doesn't happen again.
Yeah, it's so true. And, just even the way Western medicine's organized, and this might sound like I'm sort of dumping on it, I don't mean to, but you take a system of the body and they specialize in that. And so pick whichever one you want, a gastroenterologist. Well, why are you feeling this way? Look, man, all I can tell you is nothing going on in your GI. Well, that means it's somewhere else in my body and you're not, you might be interested, but you're not qualified. And now it's up to me. So you put the patient, if you think of a hub and spoke, the patient's in the center. Well, that's the exact wrong person to put there, but there's nobody else to go there. And surrounding the patient are all these specialists going, not me, not me, not me. And well, wait a second. Yeah. Okay.
Yeah. I mean, even orthopedics, for example, let's say they're the bone doctors. Now they specialize in just the knee or just the hip,
right.
Just the shoulder. And in the old days, they did the whole thing.
The whole thing. Yeah. Doesn't that make sense? The body's a system. Everything works together. It's integrated.
Yeah.
Doesn't that make sense? Yeah.
Yeah. Part of it is potentially just the way the training is structured. Part of it is we've had so many advancements in technology and approaches and procedures that they do need to specialize. There's that piece. But then there's also this fragmentation that, internal medicine doctors are not getting enough time to do a systems-based approach. So they're like, hey, go here, go here, go here, because I don't really have time to do all of it. We struggle with that as well. And the other piece is intellectual knowledge. It's difficult to know it all.
Mm-hmm.
It's just difficult to know it all. And there's so many advances in all fields of medicine to keep up with PubMed articles, to keep up with research, to keep up with all of that. So I can understand the whole consultative process of go here, go here, go here. So it's a multitude of different factors why that happens. In our practice, we do a systems-based approach, and of course we go deeper, but yes, I do also send out for consultations for particular things.
Sure.
So if I can't get them better after 6 months, I say, hey, we need to send you to the top guy for this, you know? And, we deal with specialists across the country that, we find for specific conditions. So yeah, it's a layered sort of answer, but, since the focus of your podcast is, essentially this private practice concept of private practice, in terms of the healing approach is, if a system's broken, we don't, some of the physicians come to me for burnout coaching, and, it's almost comical to say, hey, do some yoga and breath work and handle the system.
Yeah. Well, right? How do they react to that?
I would never say that, because that has been the wellness approach in the broken system is let's create physician wellness in a broken model. It doesn't work when the physicians are stretched to such a degree that you can't fix the physician's stress because the system's broken. You need to change the system so that the physician can change their lifestyle and support them in a way that they can live with wellness. Right. So that's why I left the traditional paradigm. I'm still an independent practice. I'm solo. We're slowly adding on providers, and there's been a tremendous interest in wanting to join to grow. But I have to shield the practice very carefully, because it's a cash-based model, and there's challenges because I want everyone to be able to afford it. I want everyone to be able to come. But, we are also trying to give, bar none, the best care possible, so we get outcomes. And, hopefully we'll see how the journey evolves. But we are, there's that fear of staying independent in a recession that is truly here. Don't
you wish they would just call it already? Just say it. The whole world is,
it's here. Yeah. I mean, it's here. And we're seeing it play out. And, from an integrative perspective, I deal with other things. I look at, food production, food availability for the United States. We look at soil regeneration issues. There's no soil, by the way. In about 25 years, we're going to
That's
feed
great news. That's
less
great.
than half the world. Yeah,
That's
yeah.
great.
So, yeah, I know.
It's not
Let's add
laughing because
another.
it's legitimately funny. It's just like, Jesus, just add it to the pile,
Yeah, and if your audience wants to learn a little bit more about soil, which I think is the crushing topic for the planet today, is consciousplanet.org.
Okay.
It's a fantastic place to learn.
Yeah.
I know we're talking about independent practices, but this topic is so critical that I want to be able to push it in the airwaves as much as possible. Because,
Sure.
For you to grow fruits and vegetables, okay, for you to grow fruits and vegetables, you need about 3 to, I guess, 7% organic content in the soil at a minimum.
Mm-hmm.
And organic content is, decayed leaves, manure, et cetera, et cetera. Without organic content, soil turns to sand.
Mm-hmm.
And you can't grow things. So now we are looking at soil concentrations in Africa and Europe, et cetera, and it's down to about 3% in some places. So, we've done interviews with some top soil experts in the world, and they're saying we have 10 years to turn it around. And I think you said you're from Illinois.
Yeah.
And the assumption is Illinois is the first state that's going to go into drought. You would think California, but it's actually Illinois. And at that point, food production, I mean, if half the world you can't feed in about 25 years, you're looking at civil wars. You're looking at it doesn't matter if you're rich or poor.
Mm-hmm.
Everyone has to eat. So there's these questions of, how do we, even in my system of cash-based, right,
Mm-hmm.
of an independent practice, I have to constantly think about creating models within a cash-based system that are, how do you say it, that are sustainable,
mm-hmm.
right? Because my vision in a cash-based practice is that the patient can come, get the tools that they need to be independent, that they don't need me anymore,
Mm-hmm.
that they're not constantly dependent on me.
Yeah.
We're not worried about losing business. We have plenty. We have plenty of patients calling that are ill and sick. So I am always looking at models where that person becomes independent of us.
Mm-hmm.
How do we do that? We coach them on nutrition, get that set. We coach them on mindset, get that set. If there's significant family trauma, childhood trauma, inability to cope with stress, altered mechanism, we fix that. We identify it, and we try to refer you to the right people. We get a game plan going.
Right.
That way, you know what systems to fall back on when things are not going the right way. That holds for, a private practice.
Mm-hmm.
You have the pillars, 4 or 5 pillars of a private practice. There's practice management, there's marketing,
mm-hmm.
there is your providers, there is finance, right? Your bookkeeping, your CPA, and revenue generation.
Yep.
There's these 4 pillars of an independent practice, and I'm probably missing technology or something, biotech, whatever. But you have these 4 or 5 pillars to an independent practice. And those systems are constantly changing, constantly developing. Mm-hmm. And even as they're developing, I'm constantly looking at models of, how do we scale? How do we get people independent? It's funny, like a private practice is like a steady structure with a lot of chaos.
Yes. Yes. If you can sort of organize the chaos, if that's allowable to put those 2 words together, right? And kind of keep it bound somehow. Yes. So that inside it's chaotic, but it doesn't bleed out. Right. Yeah.
And, I never ran an emergency department. I was a doctor in an emergency department. So I had a team of nurses and residents and hospital administrators that I had to deal with, but I wasn't, the head of a hospital.
Right.
So it's a different role for me. Definitely running my own independent practice is, in terms of leadership skills, in terms of administrative, I realized so many things about myself, and this about entrepreneurship, right? Like I struggle making decisions, and I'm an ER doc. I had to make decisions on the spot. And, I laugh at myself sometimes. I'm like, where is this coming from? And, I have to explore that.
Mm-hmm.
Why am I blocked in this? And so I start journaling, and I keep looking, and every single day is that work. Because, unless I'm constantly developing my system, my inner system,
Yeah.
Now, your business, your independent clinical practice will only be as stable as you are.
Hmm.
Your medical practice will only scale as much as you scale internally.
Yes. Yeah. And the scaling, a lot of people get stuck there because it's any small business, whether it's, healthcare, medical, or otherwise, you hit a point where you feel like this is as busy as I can currently get. And then you got to figure out how to bust through that. I read something once that said, so you build systems for a practice, for a business or a practice, whatever they are. And when your patient or client volume or your revenue triples, everything that you built now breaks because it can't keep up and you have to build it all again. And so I keep that in the back of my mind for my own marketing agency. Go, all right, have I just keep an eye on this, Carl? I'm sure it's, but the way that you do things, I'd like to break through them because that means I'm a larger agency, but you get this, do I really want that? That feels painful. I don't really know how long it would take to fix that, or all the uncertainty of breaking through that to the new normal, which you hope you get to, right? But you gotta, when I'm watching it, I say, all right, this makes me feel uncomfortable. I must try it, or you can't just push it away because that's when you own the place, you have to try to bust through those things. Absolutely.
Yeah.
You
I
know?
mean, yeah, most people's limitation is usually a survival-based mechanism. It's fear.
Yeah.
Fear. It's just fear, uncertainty. So as we do the self-work, and that's part of the healing and the holistic approach, is as we do the work, it starts to flourish and it shows up in our business.
Yeah.
And the other piece is, other things I realize is, I'm a grinder. I work, that's me. But
No problem with
I
that.
use, yeah, the challenge though is sometimes I compromise connection and community, which I think is also really critical for growth.
Mm-hmm.
Um, my team that I've now selected is, they're phenomenal. I mean, they're
Mm-hmm.
just phenomenal. And um, I'm humbled by them every day. And they, update me on things and, they think independently. And I don't really, really watch over them much. They're
Yeah.
just flying solo mostly.
Yeah.
And we have like weekly check-in meetings and, things are just done.
Mm-hmm.
And so I'm, truly humbled because I think that, sometimes I didn't trust community. And I
Mm-hmm.
wish I had done that a little bit more, a little earlier,
Mm-hmm.
that I would have gotten that support quicker and maybe started this earlier. There's always what if.
There's all, oh yeah, you
Yeah.
can spend all day going, boy, I wish
Yeah.
I should have this, I should have that. Yeah. Shoulda,
Yeah.
woulda, coulda, as my father used to say.
Yeah. Yeah.
Terrible way to live. Yeah. Oh yeah.
Yeah. Yeah. And the other thing I really want to highlight, and I don't know if you know this, is one physician in America, every single day in America, one physician commits suicide.
Jeez, I did not know that.
Yes. Yeah. So the
Wow.
burnout, yeah, every single day, one doctor kills themselves in America, which is an astronomical statistic.
Mm-hmm.
The other populations that are very high risk for suicide are sacred vets for this
Mm-hmm.
country, and the American farmer
Mm-hmm.
is the
I
American
believe
farmer.
that. Yeah.
So given that our healers are killing themselves, it can tell you the rates of burnout and the rates
Mm-hmm.
of stress that we're dealing with
Yeah.
is um, is phenomenal. One of the foundations really working on this is called the Lorna Breen Foundation.
Okay.
Other private practices and other doctors are going through this in your podcast. They can reach out. It's called the Lorna Breen Foundation, and they're doing a lot of legislation at the federal level. Lorna Breen was an ER doc. She was my senior,
Hmm.
and she committed suicide at the height of COVID. And
Jeez.
she was probably, I mean, Lorna was Lorna. She was magical. I mean, she was the head of an emergency department. She was an alpine skier. She was a violinist. She was passionate. She was happy. She was joyful. I mean, she would be the last person that this could potentially happen to, basically.
Yeah.
Yeah. So if
Okay.
this happened to her, it's a wake up call.
Right.
And I think her brother-in-law is an attorney and was able to kind of do a lot of legislative work and bring it to President Biden, and the Lorna Breen Act has been passed. And it
So
has a
okay.
lot, yeah, it just got passed a couple of months ago, I believe.
Okay.
And it provides hospital structure and support for physicians in case they're burning out running their practices,
Yeah.
or it allows for states to not ask that question if I apply for now, let's say the state of Florida or any other state for a licensure, it says, do you have any mental health issues? And based on that, they can reject your licensure.
Wow.
So they're dealing with those issues kind of on the legislative level. They are creating a new board. They're doing some fantastic work. Probably the most active organization in the country right now is the Lorna Breen Foundation
Okay.
in terms of supporting physicians that are burning out.
Okay.
So, that's important to know.
Let me ask you this. So if we put ourselves, sort of back to the beginning about, are you stuck in your practice? You are stuck, you are burned out, or for whatever reason you want to make a change. One part of practice that I think you're an outlier, that because you mentioned the word marketing, one part of the medical world, they own a practice. Marketing is not usually thought of, certainly not in advance, like when you're getting ready to open. It's if my experience is any indication, it's we've just opened, now we need some help. So the idea of what if you open a practice but nobody knew about you or knew what you did? It's really, it's really important. No patients, no practice. Add to it, so you are at a, your practice is, it's a different mindset, right? Most of us are in sort of the Western mindset. If I don't have a problem, if it doesn't hurt today, I don't need to go see a doctor. And you're coming at it from the other side. So get well, be well, stay well. That takes some work and it takes some care. I'm curious, like, what are, a couple of ways to grow your practice, like attracting patients? Because they don't think the way you are oriented, the way your practice tries to help people that have worked. And then, like, I'd love to, if you're willing to share an area that, you tried this and it didn't work, just like as a good lesson, for others.
It's definitely the area that we struggle with in our practice. We incorporated in August of 21. We launched January of this year. So we're fairly new practice.
Okay.
That being said, I've been doing independent integrative consulting for years, for the last 10 years. But in terms of a clinical practice, so we've looked at our systems, we've looked at, done our research, Facebook ads, Google ads, Instagram, this, that, et cetera. You know the deal, right? You're a marketer.
Yeah.
First of all, let me say this to all physicians, whether you're starting today or yesterday or whenever, I think marketing is critical in today's day and age. It's basically an accepted. And if you're independent private practice, I highly suggest you have a very functional operative website. And just basically you need a website at the basic. And practices that are not doing marketing are not doing well financially. It's directly related in terms of growth and scale. And that's just a given. There's no areas of debate about it.
Amen.
Now, right. I mean, I did not know you had a full marketing agency, but I mean, yes.
I hide that intentionally. Yes.
Yeah. I mean, it's a given. It's like a no-brainer. That being said, the challenge that I've found is to find the right agency that sort of speaks my vision, because a lot of times I will do my own independent research. And if I go to a marketing agency, and I've tried them, maybe this was a couple of years ago when I tried to, hire some folks out, I would get a bunch of analytics and I just didn't know. I didn't know what they meant. I didn't know how they were actually translating.
Oh, you mean like the monthly report with the data dump? The data dump? Yeah.
Right.
Yeah.
The data dump. And then for someone to tell me, does the data dump actually translate to anything in terms of tangible metrics? And so the metrics are 20 million people looked at your website, but one person booked. I'm just exaggerating.
Yeah.
I get that part. That's basic. I'm talking about all the other stuff that comes with it. And so we did not really gel with a lot of companies in terms of direction and time. And I saw that they were struggling, marketing agencies were struggling with really giving us the time that was needed because they're so busy themselves. So what we ended up, and maybe that's just companies that I came across, whatever.
Sure.
That being said, so what we ended up doing was we hired an independent marketing consultant that we just have her once or twice a month to give us strategies.
Oh, okay.
She just gives us marketing strategies. And again, we're launching our new website in 2 weeks, et cetera. But she gives us strategies and we have an in-house marketing person.
Okay. That's good. Who give you the time. That's right. Yeah.
who gives the time,
Yeah.
who gives the time.
And gets to know you. Yeah.
Yeah, who gets to know me, gets to know my philosophy. So all our posts 3 times a week are, edited by me and looked at by me,
Hmm.
because the vision. So, and the other thing is, some people say, well, TikTok is the hottest thing. It's the hottest thing. You've got to do it. That's great. I don't mind that. The challenge is, it's the message. We just had this meeting yesterday. How do I want to come off on TikTok? What is the voice and the messaging that I want to give? Am I doing a dance? If so, am I at a grocery store talking about labels? And do I want to be perceived as this or perception as that? So the vision, it's not just about how many people book. It's about the vision. It's about who's calling you. And some people might say, well, you know what, it doesn't matter. It's just about how many people book, and you just got to grow the business and get this much money in and this much cash in. I get all of that. We're not at that point. Yes, exactly. In our practice, that is not what we're about.
Yeah.
To exude a certain, vision, a message. We want a certain clientele to come, and we want people who really are serious about getting healthy. And
That's what I was just thinking. For you, you are not I don't know, the standard primary care practice. You know what I mean? Like there isn't a good example where you could say, well, they should take anybody. But it strikes me that you need a certain kind of mind frame or mindset of the person walking in.
yes, yeah. And I wasn't that particular before, because if it's just revenue, right? We're not just relying on patients. We're about to launch a $21 a month weight loss program with my registered dietitian, functional dietitian for 20 years next month. So we're hoping a large number of people join that. We're going to push marketing for that. We have a summit that's in the work to launch for autism and weight loss and long haul COVID. So we have a lot of different things that are working as revenue-based models.
Right.
Just that the patients that are coming to us, I want like people that are ready to work, to focus on their health. And so what's the message we give, right?
Mm-hmm.
And so it's not all about revenue. And if you focus just on that, your systems become limited. Your approach becomes limited.
Sure. Because you have to pour in a certain amount of time, whether they're good or bad, right? And you don't necessarily tell right away, oh, you're a bad one, you're a good one, but that time's gone. Can't get it back. So better screening up front. Yeah.
Pretty much we screen. And I want to change that paradigm for myself. I don't want to say good or bad. I want to say patients who are ready to work. And
yes.
Really, and a lot of times patients have significant trauma and self limitations, so that they say, I want to get healthy holistically. They'll come, they'll sign up. But truly, what they really want is someone to just hear their pain. It's not necessarily, or they want to continue patterns of trauma, because I'm seeing more and more of that.
Yeah.
They're not receptive. They say they intellectually think they are, but when transformation, it comes to the point of transformation, and we're saying, you need to do this. You need to do this. We've seen it in 20 years, thousands of patients. This is what we know.
Yeah.
This is evidence-based. They're not ready for it.
Yeah.
And, I'm sort of a little bit of a rebel, being an ER, I don't do anything by the book always,
Yeah. Right.
No, I don't.
You can't always. Yeah.
No, Western medicine is evidence-based. Eastern medicine is more energetic based. It's intuitive. It's not always, tons of data. The studies are all, small scale, 30 patients, 50 patients with, dosages of turmeric and fish oil that vary, all over the place. So we look at best practices. We are very careful what we put folks on, but a lot of it is intuitive. It's the practitioner.
Right.
It's, our practitioners are very, quick and able to intuitively hone in at the first visit on the problem. So for example, we had that ADHD case I brought up. We had somebody who had ADD and came to us for ADD. And immediately, she said, I get dizzy after meals. And went from there to, she's not eating enough, went from there to diagnosing her with potentially anorexia, went from there to diagnosing her with potentially body dysmorphic issues. And she said to us, you know what, 20 years I've been going to all these places, and you guys, put it together in probably one visit, because we knew the MO, we knew exactly what was, she was coming for one thing, but it was completely, totally different.
Right.
Anyway, I digress as I get passionate about these things, but
No, but we think about, I mean, you said a couple of things, a way to, something that works to grow. One thing is just being, I guess if I hear you, I guess grow carefully, think about every practice, even if you think you can take anybody, you should think a little more carefully about who you want to take to the extent that you can. Yes, maybe on day one, you take a lot more than you end up saying that you want to, because it's day one. And part of it is you need some revenue, and part of it is you just don't know any better. You have to have some patient experience to go, oh, they're not a good fit, and I wouldn't have thought of that. I'm wondering if there's something that you've tried, although you're a very young practice, that just didn't work. That could be a good kind of cautionary tale for others to keep an eye out for. There's nothing categorically good or bad, but something that just you looked at and you go, oh, that's not going to work.
Oh my gosh, there's a whole lot of things. I mean, a whole lot of things. When I tried to launch this practice in 2015, 2016, I made a lot of errors.
Yeah.
A lot of it was, business strategy was off. I just didn't have the skills, and the people I trusted were not great in advising me. It was more me. It wasn't them. As I fixed myself, I fixed everything around me. It's all about going inward. So what did I do?
What changed?
So I read books on business management. I read books on healthcare reform. I read revenue strategies in integrative medicine, percentage of practices that close, where are they getting their money? I mean, hell, I educated myself, till kingdom come. And, now I can see the clarity in my decisions. If I hire a strategist, like we hired a practice management group to say, hey, starting my practice, I gave her a 20-page typed up financial report by me of all revenue generating strategies. And they came back and said, oh my gosh, we've never had this before. And,
would you like to come work for us? Because I'm kidding, but
yeah. And that was just mistakes I learned from. I hired a practitioner who I didn't believe in myself in integrative medicine and my knowledge base. So I would think, oh, this person's more experienced and that person's more experienced, and, hire them in. And my selection process was not rigorous. So now, perfect example, our dietitian, and several others that are coming on, our massage person, our herbalist. My interview process is a lot more serious. It's recommendations based. We run about 3 to 5 cases in detail on what the approach should be, how they would approach it from their Eastern training. And because it's a very non-tangible specialty, right? There's no guidelines, so people can do whatever the heck they want if they're not properly trained. So like our Ayurveda consultant is, we have 2 consultants, and one is probably top 3 in the world. He's written 25 books on Ayurveda. He's out of New Zealand, and he's consulting for us. And somebody who's on the World Health Organization for Ayurveda and writes their policies on Ayurveda. So highly skilled, highly trained people, because, and I learn a lot from them, because it takes 6 years to do Ayurveda, 6 years to do Chinese traditional herbal medicine in China. So these are folks that know their industry, they know their art, and I truly don't know a lot of what they practice. So it's a collaborative effort. And so we work as a team in getting, patients better. That's always sort of been my vision. So yes, my practice management decisions got better because I studied the industry. So when I interviewed our herbalist, I would ask all these questions in the interview. How do you treat this condition? What herbs would you use? How do you, decide if yin and yang is off? How do you decide this, etc.? And if the questions were thorough, then I would hire, and it's been great that way. But I realized this was all about me. If your practice is not working, yes, I understand all limitations, insurance, but we can't put it all on that, right? We have to continually try to work our systems. The only way we improve our systems is if we work on ourselves. And in that regard, I would say the program that altered my life and changed my system was, inner engineering. It's the yoga meditation that I did with Isha Foundation that sort of catapulted my whole journey into this and really helped me transform.
Right. A lot of, and a lot of lessons in there. I mean, if I try to boil it down, what comes to my mind and what I heard you sort of express more than anything else was, in no particular order, you have to know yourself. You have to know what you're getting into. You should educate yourself. Dr. X, you know who you are. You think you know everything, but you don't on the business side. And that's more than, you got to get below 50,000 feet. You got to get granular. You've really got to, and take your, decide you're going to try to get smart before the day you open, and then you're going to learn the rest. Or you're going to say, screw it, I'm going to open up and I'm just going to have faith that I learn fast enough along the way. I think the only advice I'd have for you there is, if you're going to pick that path, have a team of people who can advise you fast, because cash goes out the door fast every day, as a matter of fact, because you're open every day. And so what Laxmi did was just follow the way it sounds like you follow the way you like to learn. I'm like you in that sense. Like, I just, one question I say, I don't understand X, and I know it's going to get bigger before it gets smaller. And the only way to make that happen, and it gets smaller again when I start to really feel like I've got my arms wrapped around it. It just takes time. However you feel you want to learn, and understand how you do learn things. Because when you open a practice, or you make a significant change to your practice, you're adding all sorts of variables to it that you owe it to yourself to have some kind of understanding of what they are. Because as a business side, you could be the best clinician in the world, but if the business side is hemorrhaging and sick, you're just not going to be a clinician in that environment for very long. Did I kind of capture it right?
100%. And I did not certain things right in terms of heavy marketing. I would tell
nobody does, I just,
yeah. If you want to open, I would say definitely start marketing easily 6 months to a year before, and start getting the word out there.
Can I clone you? And because I have a client just last week, 2 weeks ago, she's, my client, they've next week, they're opening they want to expand into this new geographic area. And I just, and I work with the internal marketing person. We just found out, I just chuckled. I'm like, isn't it great that we're always the last to know? Like, why would you say you're going to put somebody in a new area, and essentially without any marketing, you're not able to tell anybody about it? So you're going to pay that person starting a week from now, but nobody knows about that person yet. Didn't you want to give them a little hits? So anyway, yes, 6 months to a year is a really nice, comfortable.
Yeah. I would say for cash-based practices, marketing is like, as practice management. If you're insurance-based practice, probably not as, like, it would be 30% important, I would say, or whatever. I don't know how to put a number, because you have steady income coming in from insurance. But regardless, I would say you need to start early. If you want to rephrase, I think the ideal thing for folks to keep cash coming in is probably a hybrid model is the way to go. And a hybrid model is obviously, got a combo of both, but it's, I think marketing, you need to get it in early, and you need to find someone who aligns with your vision, and can take your vision, quickly. But I tell practitioners, you've got to keep the marketing agency accountable. You've got to check in with them. You've got to see what they're delivering. What are their deliverables? If they're telling you to do, Google ads or Facebook ads, and what stage you're in, and to advise you at every single stage so that your money is being stretched correctly. Yeah. And, I think that's, in my practice, I will tell you that marketing is the greatest unknown for us. And so we're trying to pin it down, in-house marketing and this consultant, but we still don't have it right. And, it's always kind of a evolving system that is probably, it's just an that I'm not versed in. And in terms of the business aspect, I feel like clinicians are pretty smart folks and they can educate themselves on business skills. But marketing, the challenge is, and I don't know, this field way better than I do, is, the algorithms keep changing, and there's all these different.
Isn't it great?
It's just algorithms change, and all the requirements keep changing. It's just so hard to keep up, in the field, that it's I don't know how you do it. Kudos to you.
There's no magic answer to that one. It's like you've got, not only you sort of in the kind of the primary care world, but you've got two different modalities going on. So you've just doubled the fun for you on how do you keep up with it all. And so, marketing is just like any other discipline. It's ever changing, and therefore a lot of continuing ed, basically. Well, actually, we could go on for so much. It's such an interesting conversation, but in the interest of kind of bringing it home,
Yeah.
I just want to ask you, so, for the folks listening, if we've caught their attention and they're saying, you know what, I picked up something from what was being said today, but I need to do something with my practice. I feel stuck. Is there one or two, kind of quick practical pieces of advice you would offer that they could, as soon as they're done listening, go, you know what, I'm going to do what she said, just to kind of get started? It could be anything.
I would say the biggest thing is if you're doing this alone, it I would say get into a community. There's
Mm,
a ton of different physician groups. There's Physicians Leveraging Growth Summit, all physicians. There's in your own city, if you're from Indiana, there's like an Indiana Facebook group of physicians.
yeah, there
If
is.
you are going into integrative medicine, there's a ton of different functional medicine, integrative medicine groups on Facebook. That has helped me considerably. I'll put out practice management questions. I'll put out, business questions, clinical questions. They respond. People
Hmm.
respond to your feed as long as you're active in those feeds. So find community if you're
Hmm.
starting. Um, I
That's
think just do,
great.
yeah, finding
Yeah.
community is huge in
Yeah.
whatever areas,
Yep.
if you're trying to build a practice, yes, definitely find a community.
Yep.
And the second thing I would say is if someone says, hey, you know what? I use this group for legal stuff for my medical practice.
Hmm.
Let's just say someone tells you that, someone you trust as a friend gives you a good referral. I would say that vet your resources very carefully. Even if someone recommends them, go in with questions, be prepared, read ahead of time. And if that consultant is able to really, I tell other practitioners, when you walk into a meeting, you should be about 95% prepared and already know your information. The consultant should provide maybe the last 5%.
Yeah.
But that's the
Yeah.
clincher. If that
Yeah.
consultant gives you the last 5%, that determines the direction of your practice. So, me giving that report, and I tell the clinicians, if you don't know, then get a consultant or get a coach. There's plenty of business coaches, legal coaches.
Yep.
We just joined our practice when we started NASE.org. It's $11 a month. You don't have to pay $400 or
Hmm.
$1,000 for a consultant. It's $11 a month
Hmm.
for startup healthcare people. They give you healthcare law, business strategies, and it's a membership group, and
Hmm.
it's fantastic. It's NASE.org, and we looked. It's out there. There's a ton of resources out there. It's a question of you finding them. These are just
Right.
ideas. So get community and get prepared. I would
Yeah.
say two things.
Yeah. And I'll add to it is get the mindset that this is going to probably take longer than you think. It's going to have more twists or turns because you're learning something new. So if you have that mindset and then get community, dive in, whether it's people, coaches, books, webinars, whatever, add it all together, dive into the
Yeah,
deep end of the pool, and you'll come out because you're smart, but you just don't know it yet. So yes, absolutely.
yeah,
Yeah.
you got
Laxmi,
it.
thank you. Thank you so much. It's excellent conversation.
Got it.
I've loved it. Learned a ton. Very interesting. Gives me hope. Gives me hope that yes, I'm not going to try to minimize it and say, being a private practice owner is easy. It's getting harder. Starting it, oh my God. Can't even, it's hard to fathom sometimes, but you give me hope. You give us hope that it can be done. It's a different model and with a lot of extra benefits. Just a couple points before we wrap up. I'll put all of Laxmi's contact info in the show notes. So anybody who wants to reach out can find that very easy to do so. And then finally, if you own a private practice and you've got an experience on the business side, like Laxmi has, that you think others would benefit from, please, we want you to come on Practice Care so that you can share your insights and help the world of private practice stay that way. In the show notes, there's a link. It's just a quick form just to tell us what you want to talk about, and then we can get you scheduled as soon as possible. And finally, if you haven't done so already, please subscribe to Practice Care on Apple Podcasts or wherever you listen to your podcasts. Thanks very much. And until next time.